Hi, I'm Ryan Tipping-Spitz. I'm the Penobscot Valley organizer for the Maine People's Alliance, a grassroots network of 32,000 Mainers fighting for social, environmental, racial, and economic justice here in Maine. I'm here to talk about what we could be doing with the millions and millions of tax dollars spent in combat in Iraq. Last year, we released a report that said for the price of funding the war in Iraq, we could accomplish great feats of humanity here at home. It pointed out that for the cost of around 7 weeks of combat, we could fully fund the State Children's Health Insurance Program, or SCHIP, and ensure that every child in the United States would have access to health care when they need it. It could shore up necessities like the Low-Income Heating Assistance Program, LIHEAP, and gaps in education funding that could only take mere days away from the war in Iraq in terms of spending. And for the price tag of minutes in Iraq, we could fund programs that retrain workers who have been laid off and provide affordable housing to those who have been forced from their homes. One of the most serious problems in America today is the lack of access to quality, affordable health care. While American citizens spend more than double the national average among industrialized nations per person medical care, we are sadly lacking when it comes to access and quality. By taking on this challenge as a nation, instead of leaving individuals to fend for themselves, we can create a system that values each human life for what it is and acknowledges a right to health care across the board. Our national cost for health care will continue to rise until steps are taken by our elected officials to create a system that prioritizes health care over profit. But especially in times like these, we should not stand by and watch money wasted, whether it's insurance company bonuses, or money spent on foreign wars that do no good to protect us here at home, while at the same time people in this country are losing their jobs and their health care. Instead of spending blood and treasure overseas, we could be ensuring a healthy America, secure safety nets, and assistance programs to any and all who need it in such uncertain times.
Thank you, Ryan. Next we will hear from Lee Davis from the Orono Peace Group.